Solution that could treat all of your pain from your head to your toes? Well, folks, there is. Our last best solution for pain is something called radio frequency ablation. Pain management specialist Dr. Christian Whitney is here to show us how it works. Welcome to the show.
Welcome, thank you.
So you've already, I guess, you're demoing it here on a piece of chicken.
That's right. So what we've started was radio frequency. What it does is it basically uses radio frequency energy that gets transmitted to the tip of the needle, and it creates heat. Now, this heat gently warms the nerve and basically interrupts the pain signal to the brain and the spinal cord. So what you see going on right here, you need to know, is very deep. It's not at the skin, It's not in the muscle, it's on the bone where the nerves are. And what that does, it takes about 5 minutes, but when it's complete, it will give you pain relief for at least a year's time.
A year?
If not forever. Yeah.
Oh, you're kidding me. So it's essentially putting the nerves to sleep. They'll regrow, perhaps, the sensory
nerves.
They
could regrow. It's not 100% permanent, but what it does is gently warms the nerves and prevents them from signaling pain to the brain and the spinal cord.
Okay. And to be clear, because I was curious about how big this was, these are the different kinds of probes.
Well, this is big because it's a big joint here.
Right. If you were going to go, I'm sorry, to a smaller, let's say you had pain in your mid-back.
In your neck. Mid-back, so low back.
You get one of these with one of these smaller ones?
One of those very tiny needles. And that's placed exactly, again, right under X-ray guidance, right under sedation, right along the course of these nerves where they run here. So you got to keep in mind that this is it looks superficial here, but it's deep. And that's why we use X-ray. And if I could just show you these pictures here, can the camera zoom in on?
Sure.
You can see how this procedure is done under X-ray guidance. So this is exactly what we do. It's imperative that it's done under this so we know exactly where we are and for your safety.
And side effects, I mean, anything that requires a needle sometimes has risks.
Of course. Well, first of all, you have to make sure that this is done by a board-certified, fellowship-trained pain physician. Okay, having said that, the risk that we see, I've done thousands of these, thousands of procedures. The most common risk I see is sometimes you have a transient increase of your pain before you feel better. Because as you can imagine, you're heating up the nerve. And so it could get a little bit inflamed before you feel better. And when it does happen, usually if you apply ice, if you just take some anti-inflammatories, it will go away.
Well, the fact you've done thousands of these is reassuring.
Thousands.
All right, so now we've taken care of lots of women. They're standing over there. I just need hands up and down.
Sure.
How are you feeling?
Much better, actually. My back is feeling better.
It is feeling better?
Yeah.
It's remarkable, something as simple as that, something that's been used for lots of years in other parts of the world. Because, you know, all humans have pain.
Yeah.
And something that's been effective like that hasn't come to this country yet. I hope this show changes that.
Yeah, I hope so, too.
All right, thanks for being with us.
Thank you.